Hello, Eric Schabert DO here. I was just out for a walk today and had a few thoughts that kept jumping into my head regarding the hormone replacement videos that I recently produced. There are a few persistent myths as I was going through my research that just kept coming up, and I want to debunk these because I think they're getting in the way of good medical care. First off, the idea that estrogen, if you give it for hormone replacement in postmenopausal women, you're going to cause breast cancer. Let's put this to bed. First off, the only information we ever had that showed an increased risk in breast cancer with estrogen was from the Women's Health Initiative, and that was for some fairly primitive synthetic estrogen progesterone combos. And even there, the slight increased risk in breast cancer incidence did not translate into an increased risk of breast cancer mortality. Additionally, since then, we have had multiple studies that have shown, we using the more modern topical preparations, that breast cancer incidence and mortality do not increase with female hormone replacement. Next up, the idea that if you give testosterone replacement to men as they age, you're going to cause an increase in prostate cancer and an increase in prostate-related urinary symptoms. The landmark Travers study from the National Institutes of Health also debunks this myth. This is a large multi-center study that compared testosterone replacement for testosterone deficient men to placebo. And in this study, we saw no increase in the risk of prostate cancer or lower urinary tract symptoms with testosterone replacement versus placebo. Again, let's put this to bed. And the third and final myth I want to address is the idea that estrogen is for women and testosterone is for men. So if we are going to address and optimize hormone deficiencies as we age, we need to look at the fact that estrogen and testosterone are of vital importance to both men and women. So let's evaluate both, and if appropriate, let's treat both. Thanks again. If you find this content helpful, please go to my channel, like and subscribe on those videos, and digest that content. Thank you so much, and I'll see you next time.